Welcome to Learning from Indigenous Leaders, Climate Change and Public Health, a video series where we hear from various speakers regarding the effect of climate change on health, why it's important, and what both public health practitioners and the public can do to improve health in the face of climate change. This series was produced by the National Collaborating Center for Infectious Diseases, or the NCCID. The NCCID is hosted at the University of Manitoba, situated on the ancestral lands of the Anishinaabeg, Anishinaabeg, Dakota Oyate, Dene Sulene, and Nahathawak/Innuwak nations. It is also in the heart of the homeland of the Métis Nation. At NCCID, we strive to honor the lands and their original caretakers in our work. We acknowledge that we are on Treaty 1 land. We recognize that this and other treaties have not been implemented in good faith, as a part of an ongoing process of colonization that benefits some of us and harms others. We are committed to working with our partners towards reconciliation. In this video, we'll hear from Maureen Gustafson. So let's get to know them and the work that they do.
So I usually like to start off introducing myself in my language. So I'll say Ani Maureen Nindishnakas Jaganashimang, Nibokan Medido Gijiguk Nindishnakas, Gojingishtakato Ishkonigan, Gawin Mashin and Shakina Masin and Dudem, Miigwech. So that roughly translates to hi, my English name is Maureen, and I shared my Anishinaabe name. I'm from Couchiching First Nation, and I grew up nearby in a small town called Port Francis. For those who might know the area, it's Treaty 3 area in northwestern Ontario. My mom's name is Joanne. My grandma was Phyllis McPherson, and my great-grandparents were George and Mary McPherson. And I just like to kind of root myself in that. I do have mixed Anishinaabe and settler roots as well. And yeah, it's a little bit about me and my personal background. So in terms of the work that I do, I did my master's in public health at the University of Toronto with a specialization in the social and behavioral health sciences and a collaborative specialization in Indigenous health. And based on those two kind of areas of interest, I like to focus my coursework on environment and health. So as I was finishing up grad school, I saw that this opportunity came up to sit on the steering committee for Indigenous Climate Action, which is an Indigenous-led organization led by knowledge keepers, water protectors, and land defenders from across so-called Canada. And I saw this as a really cool opportunity to merge those two areas. I learned so much from sitting on the steering committee. The folks who are involved in that organization, like who actually work there, and the other steering committee members are super amazing, and I consider myself super lucky and privileged to sit in like that circle with them. The steering committee is really intended to provide guidance at various levels of the organization. So for me, because I have experience in like research and survey development, like helping to design surveys for youth that they put out or for staff in relation to healing justice. Some of it's to be able to have someone speak to Indigenous views on climate change.
Why is climate change important to you?
First thing that came to mind for me were my nieces and nephews. So I have a lot of nieces and nephews, some of whom are blood related and some of whom are more like honorary. But I think a lot about them and what kind of world we're leaving behind for them. One day I might have children of my own, I'm not sure. But regardless, I think it's something that's common for a lot of Indigenous communities or nations is to think about the coming generations. So for Anishinaabe people, like for the community that I'm from, we're often taught to think 7 generations ahead. So thinking literally about how the decisions we make today will affect the next 7 generations, which is pretty amazing, I think. It's not easy to operate that way in today's world, unfortunately. We're really hyper-focused, I think, on the individual and even the nuclear family, but definitely not on like the more extended family or broader community, which would also include those future generations, right? So to me, I think that's why this work is so important, because it's going to have such a profound effect on, like I said, my nieces and nephews, but also all the ones who will come after them.
How does climate change affect infectious disease in public health?
I can think of a few ways that it will impact that. So a big one is that with increasing temperatures, a lot of like vectors or living things that carry disease will be able to survive in places that they wouldn't have been able to before, and their range will expand. And this will lead to an increase in the diseases that they carry. So a good example is Lyme disease, which is caused by a bacteria that's transmitted through deer ticks. So in Treaty 3 territory, which is where I'm from, we've seen a big change in the prevalence of ticks and consequently of Lyme disease. So when I was young, I don't even remember ever getting a tick or having to check for ticks after spending time outside. It's been a huge change for us here, and I'm sure in many other areas as well. I also think about this because I have a dog. And so these things don't only affect humans, they affect animals as well, right? So that's a big one. And I think another thing to consider in relation to infectious disease and climate change is that because temperatures in the Arctic are rising at a faster rate than the rest of the world, that's a really important area to pay attention to. So this obviously has direct impacts for folks who live in those areas, many of whom are Indigenous peoples, as it completely changes their way of life. But in relation to infectious diseases specifically, it also poses such a huge risk because ice and permafrost in the Arctic serve as reservoirs for bacteria and viruses, some of which are thousands of years old. So I think in 2016, for example, we saw that there was a big outbreak of anthrax that affected, I believe it was reindeers as well as human, and maybe some other kind of living things as well. But that was an infection that actually came out from permafrost melting. So when I was thinking about the relationship between climate change and infectious disease, when I was asked to do this project, I started thinking a lot about the historical context. So some folks may or may not know that historically infectious diseases have played a really important role in the colonization of Indigenous peoples across what we call the Americas. So Europeans brought many infectious diseases with them to what they called the New World. Again, we don't necessarily use these terms as Indigenous people, but they're terms that folks might be familiar with. So because Indigenous people hadn't been exposed to these viruses or bacteria or whatever they were, they didn't have immunity, meaning that they were hit pretty hard by these infectious disease outbreaks. And in some cases, plural, communities or nations lost really large proportions of their populations to disease. And colonial officials at one point actually started using this to their advantage. So you might have heard of smallpox blankets, which was when they would give blankets to Indigenous people that had been used by folks who had died of smallpox. The idea was that the blanket would be infected with the smallpox virus that was shed when the people were sick. And then this blanket would be passed on to Indigenous people to try to purposely infect them. So there are records in written and oral history of this practice being used to subjugate or completely wipe out Indigenous communities and nations in order to win wars, to gain access to resources, to settle land. And when we talk about infectious disease and climate change and Indigenous people, I think that's really important.
How does climate change affect Indigenous communities?
So a lot of the communities that I work with in Northern Ontario are remote, meaning they can only be accessed by plane or by ice roads in the winter. This means that their access to integral things like food, medical supplies, and even actual healthcare practitioners to come into their community is already really limited. And with climate change, this becomes very intensified. So changes to precipitation patterns and major weather events can delay or prevent flights. And that makes things really challenging because, again, that's the year-round form of transportation. But increasing temperatures also mean that ice roads aren't safe for as long as they used to be. So for folks who aren't familiar with ice roads, in remote areas where there aren't roads to get to communities in the winter when it's cold enough and when the ice is thick enough and it's deemed safe, folks can drive over lakes and rivers to get where they need to be without taking a plane. And because that window is so much shorter, it's a huge challenge, right? And this really limits access to really important things. So it was even an issue with COVID-19 tests in the early days of the pandemic, to give you an example that's directly relevant to public health. And as many of you will know, a sample only actually remains viable for a few days after it's taken. You can't just let it sit for weeks on end and then test it and get a valid result, right? It's a huge challenge for a number of things, but that transportation piece is so huge for a lot of remote communities, I think is the takeaway. Another impact I thought I'd talk about, it's a really important one to me that I think isn't necessarily talked about in mainstream contexts as much. Like, it really is super unique to Indigenous communities. And that's the impact that climate change is having on Indigenous languages, cultures, and knowledge systems more broadly. So our cultures and languages are intimately connected to and shaped by our relationships with land and waters. So when those things start changing due to climate change, we really lose our ability to connect with our cultures and speak our languages. And a good example of that is climate change leading to a decrease in biodiversity. So some communities whose subsistence patterns revolve around things like maybe the salmon run or the caribou hunt can no longer engage in those types of activities in the same way, if at all. Some Indigenous nations who follow any type of clan system are losing animals that make up those clans. And we also know that climate change leads to an increase in extreme weather events like flooding, as I mentioned earlier, which has caused communities to really lose access to some of their sacred sites and places. So these are just a few examples, but I think the key point is that when we stop engaging in ceremonies or hunts or whatever those activities may be, we start to lose the knowledge and the teachings that are transmitted through them. And we also stop using the words in our languages that describe those activities. And this is really distressing and tragic for people, just because it builds on colonial violence that we've already been experiencing over the past several hundred years. So it's not isolated, right? It has that context to it. And that means there are pretty severe impacts on our physical health, mental, emotional, spiritual well-being, all of those things, because these events don't happen in isolation. And the other thing I would add is, not only does this cause these direct adverse health outcomes, we're also losing access to things that are health promoting and even life promoting for our people. So increasing evidence is showing a strong positive correlation between culture, language, and health for Indigenous people. And in that sense, cultural continuity and competency in our languages are really strong determinants of health in and of themselves. So this is something we've always known as Indigenous people. Western science is kind of catching up in that sense, and it's great to see. But we really need to be able to practice those things. And like I said, climate change is a huge, huge barrier to that. We also should think about that relationship between climate change and colonization, because at this point, there's no doubt that climate change is anthropogenic or caused by humans. And I think it's important to think about, well, which group of humans created this way of life that's so unsustainable? Who benefits from it? Who suffered and continues to suffer in order to access and control the resources that are so key to this way of life? So I'll leave viewers with those questions. The answers really do highlight that relationship between climate change and colonization.
What can public health practitioners do to support health in the face of climate change?
I think my response for public health practitioners isn't very different than the response I would give to the general public. I think above all, it's really important to think big and to try to understand this bigger picture and how these things connect, and employ a diversity of strategies. So I don't think that there's one thing that's going to make or break us. It's going to be a lot of little things, right? So we do tend to hear a lot about what we can do as individuals, like eating less meat and active transportation, things like that. And those things are really important and really great. But when some of the most significant contributors to climate change are multinational corporations, and we've clearly linked what's going on to these big systems like colonization and even capitalism, not enough to do just that. So I would say that we really need to move beyond this individual level focus, because climate change is inherently political, right? And really thrives on these systems of oppression that we've talked about and that are really at the foundation of this country. Indigenous people have so much knowledge about their environments and climate change. We've been living on and taking care of these lands and waters for thousands of years. You may have heard that Indigenous people represent 5% of the world's population, but protect over 80% of the world's biodiversity. I think all this is to say that we're already doing the work, and hopefully we would love your support, and we need your support. So I would urge everyone to learn more about the territory that they live on and listen to Indigenous people in that area. If you can participate in nonviolent direct action, that's really important. using your privilege to amplify Indigenous voices, and follow and support groups that are already doing this work, right? And I think as healthcare practitioners or public health practitioners or both, a lot of folks do have that privilege that they can leverage, right? A lot of people in our society have a lot of respect for folks like nurses, doctors, epidemiologists, people like that. So yeah, I would just encourage everyone listening to think about how they can use those privileges to amplify other people's voices, because they might listen to you. Like the folks who need to be listening might listen to you, and they might be more inclined to listen to you than they would be to Indigenous leaders for sad reasons. So that's a big one, I think. As a steering committee member for Indigenous Climate Action, I can't not make a plug for their work, the work they're doing. Yeah, the way that I think about these things has really been so strongly influenced by their work. And I would highly, highly encourage other people to check them out. And they have a lot of really, really exciting things going on and could always use support.
What can everyone respectfully learn from Indigenous knowledges on this topic?
I would say that there are a couple of big things that folks can learn from Indigenous people. Before I launch in, I just want to acknowledge that there are diverse Indigenous nations and teachings and ways of knowing across so-called Canada and so-called United States, I guess. And they're not all the same, although there are similarities. So we don't want to necessarily homogenize. But with that being said, there are some key similarities between nations and all of those things. So one thing that's really common is the idea of reciprocity, the idea that if you're taking something, there also has to be a give. Because I think right now we're so focused on this take, 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 take. And that piece about giving back is kind of lost, right? I mean, that applies to the way we interact with the natural world. And it also, to be fair, applies to our relationships with patients or with the people that we work with in community. I think it's a really important thing to think about in all of those settings, but it's definitely a really important one in relation to climate change. And these are all very interconnected, so it's hard to parse them out. But another really important thing is relationship building. And that takes time. And it also takes the ability to really listen to people. And not only relationship with other humans, which is really important, but relationships with the land, with the water, with non-human beings like animals, birds, four-legged creatures, all sorts of things. That goes back to the idea of reciprocity too, right? But that's an important one. It also applies to other areas of life, like how do you cultivate relationships with your patients or with the folks that you work with in community? Are they meaningful relationships? Are they just relationships of convenience? Do you take the time to nurture them? Things like that, right? And when we do that in one area of our life, I think it tends to bleed into other areas too, which is why I kind of talk about these different contexts. So I think when a lot of folks, whether they're healthcare practitioners, public health practitioners, or folks that are working in any other sector or just living their lives, I think that when they hear this kind of information, there's this motivation to act, which is really important and really great. We don't want to lose that motivation. But what happens then is that people tend to go out and they make contact and they want to make something happen right away. And in a perfect world, it would happen right away, because these are really urgent and pressing issues. So I understand that sense of urgency, but often that comes at the expense of the relationship piece, right? Because you can't build a relationship overnight. So if you're going, especially to an Indigenous elder, that's not going to be a relationship that just develops overnight. That takes a lot of time and a lot of concerted effort to follow the protocols that they want you to follow, to think about how you're going to be reciprocal in that relationship and not extractive. So yeah, I guess I would say that the key things are, again, allowing enough time for those relationships to be built and to be nurtured, and being really intentional and thoughtful in the way that that happens.
Thank you for listening. All videos, infographics, and resources from the Learning from Indigenous Leaders Climate Change in Public Health series are available on the NCCID website.